Hey everybody, it's Dr. Galvin with another post-night shift ER update. Apologize, I haven't really posted much, even on Facebook. I usually link to studies and things like that. And I haven't really done that much in the last 10 days or so because, honestly, I'm burned out. It's just a lot. We've just been seeing so much COVID, both in my clinic and in the ER. It's just been crazy. You can see my background here. I'm filming in a little different place today. Somebody's dictating in our physician's office, so I'm in the little classroom next door. For those of you new to the videos, my name is Jeffrey Galvin. I'm a board-certified emergency medicine physician. I've been taking care of COVID cases and giving updates since the beginning of the pandemic. I also have a functional medicine, precision medicine clinic that I run in Charlotte, and so take care of patients on the other end of things, long COVID, post-COVID, and mild outpatient cases. Disturbing news today. I was talking to one of our critical care doctors, and she was telling me that 90 to 95% of their ventilated patients are not making it. And that's a number that I've been hearing from providers kind of all over the country. There was about a 40 to 50% mortality rate with Alpha when people got on the ventilator, but we're hearing from more and more doctors all over the country that the mortality rate for Delta, if you get on a ventilator, is 80 to 90%. And it's heartbreaking because most of these people are unvaccinated, and unfortunately, most of them are young. And just last night, we had to intubate 3 COVID patients in the emergency department, and we had a 4th one die in the emergency department. One of them was in their 70s, but the other 2 were less than 50 years old, and they're both on ventilators. And we put them on the ventilator knowing that if we didn't put them on the ventilator, they were going to die on the spot, but also understanding that there's a very high likelihood that they're going to pass away because most of these people are not getting off the ventilator. The critical care doc I was talking to here from my hospital said that since the beginning of the summer, they've only gotten 3 people off the ventilator. And they've had, in our hospital alone, 14 or 15 deaths in just the last week. So the good news is that it does seem like the numbers of COVID cases is dropping. We've been, I think I've shared with you before, we've been looking at 17, 18-hour waits in the emergency department, and a vast majority of those people being unimmunized COVID patients. Well, we're still seeing a ton of COVID patients. The majority of them are unimmunized, but it just seems like the volume has dropped a little bit. And for the first time in a long time, I think I saw 17 or 18 patients in my shift. We've been so constipated in the department that there have been nights where I've only seen 6 or 7 new patients and spent most of my time managing existing patients, most of them really sick COVID patients. So that's a little bit, I'm hoping, and I think I've made that prediction going back a month or 2 ago, that I thought we'd see a huge peak, and then we would basically either get everybody vaccinated or infected, and then the numbers would drop. The flip side of that is that we're going to start seeing deaths go up. And why is that? Because deaths lag the cases by 3 to 4 weeks. And so when people end up, the progression is they start off on the floor, they worsen, they end up in the ICU on high flow oxygen, then they end up on BiPAP, which is an external ventilator thing where you're still awake, and then they fail BiPAP and they end up on the ventilator, and then they last a couple weeks on the ventilator, then they die. So it can be a month or longer after they are admitted to the hospital before they actually end up passing away from COVID. So we'll probably see a spike in deaths nationwide at the same time we're seeing a drop in cases, and that's just the nature of the business of how COVID works. I'm exhausted. It's been a long shift, and again, I've just been feeling burned out. I'm trying to get re-energized again, and I am going to try to talk about from a request that someone sent me about COVID psychosis, because we've seen some cases of that, and I've gotten some messages from people that have had relatives that had COVID psychosis, one that actually resulted in suicide, and I think we should talk about that. And I'm here for the next couple nights, so I'll probably post the next, at least 2 out of the next 3 days, and if I'm really feeling my oats, I might post all 3 nights. Anyway, as usual, stay safe. Please, please put the politics aside. Get immunized. You know, you don't see ER doctors or critical care doctors on the internet telling you not to get immunized. They're all people that don't take care of patients, that don't take care of sick patients. They're chiropractors or allied health, or you know, people that have a lot to say but have never actually taken care of a sick person or never had to watch one of these people die in front of you. So, you know, listen to the doctors who are actually caring for these patients. You don't want to be one. And I've told people from the beginning, you know, immunizations don't work, masks don't work, distancing doesn't work. They are not 100%, none of them are. But if you layer those things, masking, distancing, washing your hands, staying away from sick people, staying away from crowds, getting immunized, you put layers of defense between you and the disease, and you're far less likely to get it. And remember, the people that are getting immunized, even those people that get breakthrough cases, are very rarely ever getting anything much more than cold symptoms or mild flu-like symptoms. So your risk of death or serious illness if you're immunized is markedly reduced. And at this point, I've taken care of hundreds and hundreds of COVID patients since it started, and I've not taken care of a single patient that was here as a problem as a result of a vaccine. So that's my overtired assessment. I'll talk to y'all soon. Have a good night and stay safe.